For my case study, I will be discussing the Green Campus of Children's Hospital of Pittsburgh of UPMC. The word green is meant to show the hospital's adoption of sustainable practices both during the construction process and their day-to-day operations. They have 2 LEED certified buildings on their campus. The hospital's focus on environmentally friendly practices include efficient use of important resources such as water, energy, land, and materials. In addition, Children's Hospital partners with the community and academic organizations to further research and public awareness on sustainability that puts a focus on the effects on children's health and patient recovery. The Children's Hospital of Pittsburgh of UPMC is a hospital located in western Pennsylvania in the city of Pittsburgh between the Allegheny River and the Monongahela River. The UPMC in the title stands for University of Pittsburgh Medical Center, which is a nonprofit medical enterprise that has many hospital networks and community-based services. They have a total of over 80,000 employees, 35 hospitals, and roughly 600 clinical locations. Children's Hospital has around 700 board-certified pediatricians and pediatric specialists. The Children's Hospital of Pittsburgh was founded in 1890. It began as a place for children and infants that was located within a local hospital and only had one single cot. It was gifted by Kirk Lemoyne, whose father was a prominent doctor in the city of Pittsburgh from 1866 to 1913. Lemoyne's father believed that a hospital built solely for the treatment of children would better provide for their needs. LEED, as I'm sure many of you will recall, stands for Leadership in Energy and Environmental Design. It is globally recognized to inspire innovative approaches to creating a building that is environmentally suited throughout the project life cycle. It was established by the U.S. Green Building Council, which comprises the nation's leaders in the building industry that live to promote environmentally responsible construction to create a healthy, profitable, and environmentally safe place to live and work. It is designed to recognize achievement in sustainability based on a points system. Points or credits are used to determine eligibility and rating. There are 4 rating levels: certified, silver, gold, and platinum. Certified status is 40 to 49 points. Silver status is 50 to 59 points. Gold is 60 to 79 points, and platinum is 80 plus points. Children's Hospital has 2 LEED certified buildings on their campus. The main hospital, serving patients and employing medical staff, has a certified LEED rating, and the John G. Rango Senior Research Center has a silver LEED rating. Children's is one of the first hospitals to receive LEED certifications. These 2 buildings make up more than 80% of the total campus square footage. Although many areas of this campus have adopted green practices, the main focus for this case study is the 2 LEED certified buildings. Transportation is important to manage because of the release of carbon dioxide and other pollutants by vehicles. For transportation to be sustainable, methods need to account for the environment, society, and the economy. At Children's, to reduce vehicle pollution, access to alternative transportation is provided. This includes rides such as buses or trains. LEED certification requires one of 2 options to satisfy alternative transportation points for projects located in the United States. Option 1, rail station, bus rapid transit station, or ferry terminal must be within a half a mile walking distance from the main building entrance. Second option, bus stop must be within a quarter of a mile walking distance of the main building entrance for 2 or more bus lines. In addition, at Children's Hospital, upon request, parents and visitors have access to a police officer that will escort them to a bus stop 24 hours a day, 7 days a week. Children's also provides bike racks to encourage biking as a transportation route, and showers so biking in any weather can be done. Bike racks and showers allow the commuter zero carbon emission travel that is socially viable and economically sustainable. To encourage drivers to carpool, Children's also has a preferred parking for carpool's incentive. So continuing on with transportation, in order to minimize the transportation burden from construction material, Children's used local and regional construction material as much as possible. This decreased environmental impacts through reduced vehicle time spent on the road. It also enhanced the local economy by putting money into the local and regional construction material sector. The use of local and regional construction material is a LEED credit. The requirement specifies a minimum of 20% of building materials that are manufactured regionally within a radius of 500 miles, where manufacture refers to the final assembly of the component materials. According to the EPA, around 7% of the U.S. water use from commercial facilities happens in hospitals and related healthcare facilities. This bar graph shows the end uses of water for most hospitals, and it breaks down the water use. Hospitals can significantly reduce their impact on water waste and pollution. On average, landscaping makes up about 7% of the total water use of a hospital. Children's Hospital applies water-efficient landscaping to reduce water use using drip irrigation and plant materials with low water needs, including drought-tolerant plants and native vegetation that is naturally suited for the climate of Pittsburgh. Installation of water fixtures that reduce water is another important aspect to the Green Campus at Children's Hospital of Pittsburgh. High-performing fixtures typically use at least 20% less water than standard fixtures. Based on business estimates, water-efficient practices can decrease energy use by 10% and overall water use by 15%. Children's Hospital has incorporated many sustainable materials throughout their facilities. They have also eliminated the use of materials that have no negative environmental effects. Such eliminations include hydrochlorofluorocarbons, halon, formaldehyde-containing materials. They also have minimal use of volatile organic compound materials and vinyl and mercury-containing products. During the construction process, children used building materials with recycled content, including 100% post-consumer structural steel. Metal production, including steel, is very harmful to the environment due to the mining consequences, excess energy consumption, and release of greenhouse gases to reduce the final metal product. Use of certified wood products was also a feature of the construction process. Day-to-day operations at Children's also use environmentally friendly materials. These include things like no volatile organic compound building materials, such as paint and sealants, which are often used in a hospital in order to keep everything looking clean and professional. Green cleaning supplies, such as non-toxic cleaning chemicals and microfiber mops and rags. Use of solutions and medical equipment that do not contain mercury, and recycling chemical and toxic solutions, for example, alcohol and xylene. Also, the majority of paper products used in the hospital come from recycled material. They have a recycling program to recover waste such as paper, plastics, batteries, light bulbs, and cardboard. Storage and safe handling management controls for chemicals exist, including spills and mishandling incident protocols to keep chemicals safely stored. Energy is a necessity for any hospital, and they need a lot of it. This is because there are many people that need technology to support, protect, and monitor recovery, which takes even more people to manage. Hospitals are also open 24 hours a day, 7 days a week, including holidays, which means no powering down. Much of a hospital's activities are energy intensive, such as medical and lab equipment use, computer systems, food service, and refrigeration. This energy is powered by many different sources, including natural gas, electricity, and fuel. One issue with having a large campus in a very large city, Pittsburgh has a population of over 302,000, is the creation of a heat island. A heat island is an urban area that is significantly warmer compared to suburban and rural areas due to increased human activities. According to the U.S. Green Building Council, heat islands can have impacts on microclimates and human and wildlife habitats. They also significantly increase energy consumption. Children's has reduced this impact by placing at least 50% of their parking spaces under cover and installing a green roofing system. Another important aspect to Children's Campus to save energy is their measurement systems for building utilities utilization. This ensures the building and its components are working efficiently. This means using technology in lighting, heating, cooling, and more that maximizes efficiency and minimizes energy waste. The construction process of a building often comes with major environmental impacts. Children's Hospital used an internal air quality management plan that flushed the building prior to occupancy with filter changes as appropriate. This was performed throughout construction to ensure a safe breathing space for patients, free from particulates and potential hazards. Per lead requirement, the IAQ, or indoor air quality, must demonstrate that the contaminant maximum concentrations are not exceeded, and these maximums and contaminants are listed here in this chart. Children's Hospital of Pittsburgh does more than supporting a green campus. They also provide education, outreach, research, and improved environmental connections. They have green education programs for staff, patients, and visitors to learn about sustainability. Research is a big part of the campus. Children's works with clinicians, academicians, and the community to further research on sustainability and its health effect on children. They also have family resources, such as a healing play garden. There are no obvious opponents to Children's Hospital Pittsburgh of UPMC. After all, who's going to do battle with a place that takes care of sick children? There are, however, many opponents to green buildings. More specifically, many people disagree with the benefits claimed by the U.S. Green Building Council's LEED certification program. Georgia Governor Nathan Deal believes this program threatens timber harvesters that do not have the desire to get the approved sustainability certifications despite using sustainable practices. He is not the only political official to be concerned about the constraints of the LEED certification program. Georgia, along with South Carolina and Florida, all have limits or bans on officially sanctioned green building practices. According to an article from Slate, critics of LEED see a system that's easy to game and has more to do with generating good PR than saving the planet. This article states that there are loopholes within the LEED certification process that is designed around a checklist and leaves out important green designs. Henry Gifford, a New York apartment building owner and energy efficiency expert, believes the study funded by the U.S. Green Building Council that concluded LEED buildings save energy is actually flawed. He believes inappropriate methodology has misjudged the actual energy saved by LEED certified buildings, and that they actually use more energy than many non-certified buildings. Another article in Forbes magazine reveals that some environmentalists believe the LEED certification is simply a way to greenwash companies without checking in that these buildings are truly adopting sustainable practices. An added concern is for the taxpayers when officials mandate adoption of LEED certified buildings. The cost up front is often much higher, and the savings in energy has not yet been satisfactorily proven in studies. In fact, studies performed by those outside of the U.S. Green Building Council show that some certified buildings perform worse on energy saving tests than non-certified structures. Although none of these opponents explicitly call out Children's Hospital of Pittsburgh, they do make some points that directly relate to the children's claim of a green campus. So when it comes to preventing pollution, I do think Children's Hospital of Pittsburgh does an adequate job. The energy that's needed to power a hospital, the equipment and the building controls are a necessity. So are the medical supplies that are often used just once and then thrown away to keep everything sterile. And these include a lot of different supplies, such as needles, syringes, adhesive pads, lab coats, so much more. But still, Children's does a really impressive job of reducing these different types of pollution. One thing that people should not and don't do is, base their choice of a hospital by the sustainability of the campus. So as far as the greenwashing goes, I don't think this is what Children's is doing. They have a green campus. They're doing their part to prevent pollution, and I believe it's because they know it's the right thing to do. And this isn't just my opinion. I think this is well supported because they've proven to be a really great hospital. They are nationally ranked in 9 pediatric specialties by US News Best Hospital Rankings, and they just really strive for greatness in providing patient care, and they have a lot of certification and rankings that show that. And they also provide good care by creating a healthy environment for everyone. Children's Hospital, I think, is far ahead in sustainability and in innovation. They're involved in many sustainable research ventures, such as use of rapidly renewable materials, individual temperature controls at 50% of non-perimeter areas, and maximum use of daylight and views with 75% use of diffuse daylight and views from 90% of occupied spaces. So they have really a lot of research on sustainability. But having a sustainable building, I think, is still a ways off for this campus. And I think this is why they refer to it as a green design rather than a sustainable one. So there are ways to make the building more sustainable, I think, such as maybe incorporating more solar power, creating some carbon offsetting practices, but there truly are some barriers to having a sustainable building. Hospitals innately require large amounts of energy, and they produce unavoidable waste because they need things to be sterile, and there's a lot going on. There's a lot of patient procedures that are necessary. So, but despite the needed advances to be fully sustainable, I think that Children's is a hospital that they should really be proud of. I think it exemplifies the care for nature that needs to be better incorporated in pretty much all areas of the industry sector. Thank you so much for listening to my presentation on my case study of Children's Hospital of Pittsburgh of UPMC. If you have any questions or comments, of course, post below. But if you would like to contact me in private, I've also provided my email address. And the next slide, I will have a list of all my literature cited. Thanks.